Hey everybody, Dr. Barron here with virtualheadachespecialist.com, continuing to work on your questions here. So this one on exercise-induced migraine, always a really frustrating, disruptive headache trigger, especially for patients that love to run or exercise or lift weights, keep in shape. This can be really disruptive to those goals of keeping in shape. There's other annoying triggers too. Any trigger is annoying, but some people have waking migraine triggers, or if they sleep too much, too little. If they have a stress letdown migraine, so they have this huge stressful event and then the next day, or they go on vacation, something where their stress is much less, boom, it triggers a migraine. Really, really cruel type of trigger, obviously. So exertional migraine, exercise and exertion for some people is just a trigger. And unfortunately, it's something that you want to try to get under control so you can, do those activities that you want to do. So treatment for this, first of all, any kind of exertional migraine, exercise-induced migraine, always requires a brain MRI with an MRA, look at the arteries of the brain, look at the brain itself. That's just kind of the standard workup for this type of headache. Other testing depending on what else is going on with the history, symptoms, examination, etc. But brain MRI with an MRA is really the optimal test. CTA is reasonable if MRI can't be done. So once that's out of the way, you treat it basically like any migraine. And so the goal with treatment is that you want to get abortive medicine. So, standard abortive therapies, you guys are well in tune with the options out there. But sometimes for this type of migraine, we do what's called mini prophylaxis. So before you're going to encounter that trigger, taking some kind of an abortive treatment to prevent it from turning on. So the classic medicine that's often used for exertional migraine or exercise-induced migraine is some indomethacin or Indocin, which is it's a specific type of NSAID, anti-inflammatory. Sometimes using that, a half hour before you start doing the activity can help to prevent the headaches from coming on. Obviously, if you're doing a lot of activity and you're having to take it a lot, that can run into whole other issues with overusing medications, liver, kidney, stomach issues if you're taking too much of these things. So if you're having to take a lot, more than 10 days a month, these kind of things, then we would typically use a preventive medicine, some kind of a preventive treatment to try to prevent those attacks from being triggered some other way. Because the goal with any preventive medicine is ultimately to decrease the frequency of attacks, decrease the intensity of attacks, and increase the threshold that you can encounter that trigger without it turning that switch on for the migraine attack. And so that is really the goal, is to find something that does that. And hopefully with that, you'll be able to encounter these triggers, do your exercise, your running, your things, exercises that normally are going to trigger the migraine. Hopefully it will not be a trigger anymore, or at least not to such an extent. All right, other questions, you guys, feel free to drop them in the comments. All right, see ya.